Hi, my name is Rose Majors, and I have decided to do my community credit project and presentation on how researchers are combating transplant rejection. So what exactly is an organ transplant? Organ transplantation is the process of surgically transferring a donated organ from another person to someone diagnosed with organ failure. Many diseases can lead to organ failure, including heart disease, which could lead to a heart transplant, diabetes, which are hard on your kidneys, and pancreas, which can lead to kidney and pancreas transplants, hepatitis, which is hard on your liver, which can lead to liver transplant, and cystic fibrosis, which affects people's lungs and could cause them to have a lung transplant. Injury and birth defects may also cause organ failure. So unfortunately, organ transplantation can lead to transplant rejection. So what is transplant rejection and how do we stop it? Transplant rejection occurs when transplanted tissue is rejected by the recipient's immune system, which destroys the transplanted tissue. Transplant rejection can be lessened by determining the molecular similarity between donor and recipient and by use of immunosuppressant drugs after transplant. And a great example of that is this awesome lady pictured to the right over here. Her name is Rima Irina, and she has cystic fibrosis. And back in 2017, she had a double lung transplant to make the quality of her life better. But unfortunately, when a transplant isn't a life-saving procedure, doctors and patients have to consider whether the benefits outweigh the risk, which may lead to some patients not getting transplants to begin with. And not only that, no organ donation can be guaranteed to exactly match the patient. So, researchers have been researching a better way to stop transplant rejection by getting some inspiration from cancer cells. And they have been inspired by a tactic cancer cells use to evade the immune system, and they have engineered tiny particles known as microparticles that can trick the body into accepting transplanted tissue as its own. These microparticles work by releasing a native protein secreted by tumors known as CCCL22, which draws regulatory T cells, or TREG cells, which is pictured to the right over there, to the site of the graft, or transplant, where they tag the foreign tissue as self so that it evades immune attack. So, what did these researchers draw from their results? The researchers showed that these engineered microparticles can train the immune system of one strain of rat to accept a donor limb from another strain of rat. And what they mean by a different strain is that these rats are not molecularly similar to each other. Microparticle treated animals maintain healthy grafts for as long as they were monitored, a little under a year, and this is equivalent to about 30 human years, which is awesome. So I wanted to end my presentation with some organ donation facts because April is Organ Donation Awareness Month. So as of January 2020, 112,000 people are in need of a life-saving organ transplant. Each day, about 80 people receive a transplant. 39,718 transplants were performed in 2019, which is barely 40% of the amount of people that needed a transplant that actually got one. So that number is way too low. So the next time you go to the DMV, which may be a really long ways away from now, just make sure that you are registered as an organ donor. Here are my sources, and I just want to thank you all for taking the time to listen to my video presentation today. Thank y'all so much!